This video will demonstrate log rolling a prone patient onto a longboard with 3 providers. The first provider maintains neutral inline stabilization of the patient's head and neck. Whenever possible, the patient should always be rolled away from the direction in which the patient's face initially points. While the first provider maintains neutral inline stabilization, the second provider kneels at the patient's side mid-thorax. The third provider positions the board on its lateral edge behind the patient and in front of the second provider with the foot end of the board at the patient's knees. The third provider kneels behind the board between the patient's hips and knees. The patient's arms are straightened and placed palms in next to the torso, while the patient's legs are brought into neutral alignment. The second provider reaches over the patient and places one hand under the patient's shoulder and the other hand under the patient's hip, while the third provider reaches over the patient and places one hand under the patient's chest and their other hand under the patient's femur. At no time should the patient's clothing be used to grip and move the patient. On command from the first provider, the entire patient is log rolled as a unit onto the board. The board and patient are now rotated to the ground. Once the board is on the ground, the patient's upper chest is grasped firmly by the second provider, with the hands placed in the patient's axilla. The third provider places his or her hands on either side of the patient's pelvis. On command from the first provider, the patient is moved upward and laterally and centered onto the longboard. Neutral inline stabilization is maintained without pulling on the patient's head and neck. Buttress material is placed under the patient's head to maintain neutral alignment. The patient can now be secured to the board with padding to fill all voids.